Have you ever noticed your little one suddenly clinging to you, or your school-aged child becoming nervous about goodbyes? If so, you are seeing a very common part of childhood development. Child separation anxiety typically shows up into main developmental windows. The first is usually between 8 months and 1 year of age, and the second common phase is between 18 months and 3 years old. Sometimes, you might also see a resurgence or intensification of these feelings during major transitions, like when a child first starts school, often around 5 or 6 years old. These age ranges are deeply connected to a child's rapidly growing brain and understanding of the world. For babies between 8 months and 1 year, the key is the development of what we call object permanence. This is when they learn that people and objects still exist even when they cannot see them. While this is a wonderful cognitive leap, it also means they understand that you are gone when you leave, and they do not yet grasp the concept of time, so your absence can feel permanent and worrying. As they approach to 3 years old, children are navigating a fascinating period of developing independence. They are learning to explore and assert themselves, but they still need the consistent security of their primary caregivers. They might also be more aware of their surroundings and potential dangers, leading to heightened anxiety when left alone in new or unfamiliar situations. Around 5 or 6 years old, starting kindergarten or first grade is a huge step. It involves new routines, new social dynamics, and being away from family for much longer periods, all of which can naturally trigger some temporary separation worries, even in generally confident children. To best support your child through these phases, you can start by establishing predictable routines for departures and returns. For infants, a consistent goodbye ritual, like a quick hug and a cheerful wave, helps them understand the pattern. For toddlers and preschoolers, use simple language to explain when you will be back, perhaps linking it to a familiar event like after snack time or story time. Creating a sense of security also involves offering a transitional object, such as a special blanket or a small toy from home, which can provide comfort when you are not physically present. An interesting insight is that healthy separation anxiety, while challenging, actually indicates a strong, secure attachment between a child and their caregiver. This is a positive sign of development. However, it is also important to recognize that while some anxiety is normal, persistent, and severe symptoms that interfere with daily life might indicate a more significant challenge, such as a true separation anxiety disorder. This would be marked by intense distress, physical symptoms, and avoidance that lasts longer than a few weeks or months, and might warrant a conversation with a pediatrician or child mental wellness professional. Understanding these common age windows for separation anxiety helps you respond with empathy and effective strategies. By recognizing that these are normal developmental stages, you can provide the consistent reassurance and support your child needs to build confidence and navigate their world, knowing you will always return.